Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Andrea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Mikhaila Riska. If her name sounds familiar, Dr. Mikhaila has been a well-known chiropractor in the Appleton area for almost 10 years now, and she's the owner of 920 Wellness Studio. But today, we're excited to introduce you to her new business, Fox Valley Functional Medicine, which just opened in April of 2025. At Fox Valley Functional Medicine, Dr. Mikhaila's goal is to help people get to the root causes of their health issues, not just manage symptoms. Her approach combines the best of functional, integrative, and conventional medicine to create truly personalized care plans that empower people to take charge of their well-being. Dr. Mikhaila is here today to share her insights on what true root cause healing looks like, why so many chronic issues are missed in conventional care, and how functional medicine can unlock the energy, clarity, and resilience we're all meant to have. Get ready, you're going to walk away from these conversations feeling inspired, informed, and ready to take your health into your own hands. Let's get started. Hey everybody, welcome back to the podcast. We are excited to welcome Dr. Mikhaila today. Welcome.
Thank you so much for having me.
We are going to have 4 awesome episodes together, and I think we're going to be hitting a lot of common FAQs that people have regarding functional medicine. But before we jump into our first episode, we always love to start with a fun fact for a new guest, and yours is actually extra hilarious. So your fun fact is that you hate birds.
Absolutely.
So before we share why we think it's hilarious, I kind of want to know, is there a backstory here?
No, they just terrify me. They're just like creepy creatures that just like, I don't know. They're birds, their wings, it just freaks me out.
All sizes?
Oh my gosh, yes, turkeys. We have so many turkeys around our neighborhood, and they'll sit outside my corridor and like lock me in my car. I make my kids run and like chase them away before I'll get home.
Oh my gosh.
Pawn my kids off.
Well, we're laughing here because as Mikhaila was walking into our studio area, there's a tree right outside the front door, and there happens to be a robin nest in it, and the robin flew out literally right in front of her.
She almost laid out right on the ground.
I should have gone back in my car, turned around.
Well, we glad you didn't.
Yeah. Well, let's talk about you a little bit. You have been a chiropractor in the Appleton area for a long time now, and now you're also branching into functional medicine. So what has inspired you to do this?
Yeah, I think I've been a chiropractor for almost 9 years now, which is kind of dating me now. But I always have had the interest in functional medicine, but just with 3 kids and getting married and moving and all the things, it just kind of got put on the back burner. So now was finally the time that I could take the time to sit and do all the studies and just really focus on my search for healthier living. My husband was also diagnosed with Lyme disease this past August. So that really kind of jump-started some of our lifestyle changes. I mean, we always lived healthy, but really kind of made us cut back on certain things too. So that was exciting to learn along his diagnosis and everything too.
Yeah. How is he doing right now?
A lot better. So that's wonderful. But it was just kind of crazy for a couple months and trying to figure out that because you kind of get dismissed by some other doctors and labs come back negative. So it was good to find some supportive providers in the area for sure.
Mm-hmm. And we do have a couple episodes specifically on Lyme disease. If those of you listening, if you're intrigued by that, I believe they came out in the May timeframe. So you can go back and scroll down and find those. But let's start with the definition of functional medicine because people hear this word a lot. It's kind of a buzzword now. So what does it actually mean?
Yeah. And as cliche as it sounds, I think it truly depends on the person. It can be somewhat subjective, but for us and at our clinic, we would just say that it's really returning to the roots. It's really about people getting control of their health and looking at different modalities of healing. So whether that's environmental, looking at your water, your air, your food intake. You can also look at your mental, emotional health, looking at your childhood traumas, and just going back into your current relationship status too. So I know that's a cheesy answer, if you will, but it could just really depend on the person. And it's just kind of the fusion of a whole bunch of different modalities coming together for more holistic healing, I would say.
Yeah, I think of functional too, like you're functioning in everyday life, right? Like how you function in everything, right? And I know, like, because it's such a buzzword and, it might be kind of thrown around quite a bit. I'm curious, who can become certified in functional medicine and how much education does it really take?
Yeah, I think it depends on your program and what you go through. So for Dr. Shea and I, Dr. Shea is my associate chiropractor. We did this coursework together. So we obviously did our graduate studies to become a chiropractor, but then we went through Functional Medicine University. So it is a self-paced online course. So it was nice that we could just sit down and do it. But it took us about 7 months to get it done for ourselves. We started last October and got done in April of 2025. But the coursework that we did, it has to be a graduate study. So like nurse practitioners, DOs, MDs, DCs. So those are all the educational pieces that need to be in place before that. But it is cool that it's open to maybe more conventional practitioners too. I'm seeing a ton of nurse practitioners interested in functional medicine, so it's neat to see that swing. I know there are some other like health coaches and some nutritionists that they also do functional medicine, so it's just important to like look at their background of where they're coming from for helping others and such too. So it's and everyone is going to be different for what their needs are, and prescriptive rights and supplementation records and labs and such too. Every scope of practice kind of has their own boundaries of what they can do as well.
Absolutely. I love that you're seeing a lot more traditional practitioners learning about functional medicine and, wanting to be in that world too. I think that's super cool. What is the difference between functional medicine and traditional medicine? Can you touch on that?
I think it's just your way of looking at it, right? Like I think a lot of chiropractors, naturopaths, and functional medicine practitioners, we look at as more preventative, proactive instead of reactive. And there's nothing wrong or anything like that with traditional medicine, but I think it's just the way that you go in and approach disease. So we want to lay the foundational roadmap for patients that they can really take their health in the driver's seat, and we're just sitting next to them in the passenger seat. And we really want to be, again, more proactive than reactive when it comes to chronic disease.
I think when a lot of people are thinking about functional medicine and what they know about it, and we'll dive into this a little bit more and hear directly from you so we can get the facts versus myths on this, but it is doing some testing, right? And typically people are coming in to functional medicine either if they've been kind of through the ringer with the traditional system and they just haven't figured out what's going on. But you're talking about prevention. So do you feel like functional medicine and like some of these testing and other pieces of it should be done even if you're not having symptoms?
I think so. I mean, in Dr. Shea and I's coaching, we can kind of lay out a protocol of like, even once we reach your symptom goals and where you want to be, come see us on an annual basis just to get those labs checked and see where your gut health is or your hormones, because it should be kind of a check-in. Even if you're doing great, that's part of just the prevention instead of reactive methodology. And it's not going to be as labor intensive when someone first comes to see us, but even if we can just check in once a year to see where you're at on your labs, or even if your emotional mental health needs a check-in and such like that too, we kind of try to cover all aspects of that.
Okay. And then kind of circling back to what most people are probably thinking of functional medicine for, like I mentioned, they haven't figured out what's going on and they are having symptoms. What are some of the main reasons people are coming to seek out functional medicine support?
I think you hit it on the head of sometimes they have just been through the ringer. They've seen their PCP, they've seen their OBGYN, they've seen maybe infectious disease doctor, and they've just been put on medication after medication, or just haven't felt seen or heard. So we really take the time through our thorough intake form to go all the way back to childhood and really see what was their labor and delivery like from themselves with their mom, which is crazy to think, but were they C-section or vaginal? Were they breastfed? Were they formula fed? And it isn't a moment of shaming, but it just gives us an opportunity to see if they were able to get certain bacteria strains going through the vaginal canal and breastfeeding and, all those types of things. So it's really important to dive deep in that and just really see where did their maybe gut health start from childhood that's now leading to them in their mid-30s of gut dysbiosis and those types of things. So we really do some deep digging, and we spend a lot of time in that first consult of education and just trying to hear their story. Whereas unfortunately with conventional medicine, they maybe get 15 minutes for a patient because they're constricted of multiple things, insurance and policy and politics and all the things.
I would also say, like, if somebody's listening to this right now, and as we go through this episode and the following episodes talking about symptoms and testing and everything else, if you're seeing something that you're like, I really need to get this checked out, go to a functional medicine practitioner right away. Don't have to go through all these ringers and get frustrated. Because I wouldn't want to go through all of that and give up and finally being like, okay, fine, I'm going to invest the money into this, and you should have done it in the first place.
For sure. And we're just there to be supportive of the journey because it can be so frustrating going to multiple providers, not getting answers. And I never want people to feel shamed that they did go searching for those, but we really hone in on, you have to be the driver of your own health. We're not going to be the one constantly checking on your everyday moments. Like, you're going to come see us and then we're going to have a follow-up in 2 weeks. But what are your decisions for your own health going to be from those appointments? So it's really important that people are that motivated to take the driver's seat, and we can just be in the passenger seat helping them for sure.
I love this. Yeah. I think it's just so encouraging that this is becoming more mainstream and more people like you. A chiropractor is stepping out into this world to be able to serve more people, because I think especially since COVID, people are looking for more natural options and really trying to find the root, like we're talking about, and not just putting a Band-Aid on something. So can you walk us through, high level, what are the actual steps of the journey of working with a functional medicine provider?
Yeah. So, like I said, with us for having a chiropractic background, we're going to be a little bit more holistic and wanting to do lifestyle changes first. But it's really important at our clinic that if you are interested with us, you come and reach out, and then we're going to send over a really thorough intake form. And we don't want patients to rush through it. We want them to be super honest throughout it. Like, don't put in your dietary log that you eat celery and asparagus every day, because
be honest.
we know that's not true. But it just serves all of us well of what's actually going on, and we're not here to judge or shame. We're truly here to help these patients. After that intake is filled out, and we really say don't rush through it. Take your time, collect all these medical records, because sometimes we need 3+ years worth of blood work, and we need previous doctor's notes. So that looks like grabbing all those from your other providers. So it's really important to have that thorough concept. Once we've received all of that information from the patient, we take the time to go through that and really digest it. And then we set up the initial consult. So it's important for us to kind of have all those pieces together before we just jump into meeting with them and potentially do some more research or get our plan together for lifestyle recommendations. Then we have the initial consult, and that can take up to 60 to 90 minutes, just depending on what's going on with the patient. And it's important to give that much time, because I don't think a lot of patients get that much time with their PCP or their other providers. So I think that truly sets us apart of sitting down with them and getting to know their goals as well. After that, we'll probably be looking at different labs or potential supplementation, but we really want to test and not guess, I guess. And I know maybe some people don't believe in that philosophy, but I don't want to waste anyone's money though either. If we're working with hormone health or gut issues, we really want to get to the root cause and heal that leaky gut or figure out why you have estrogen dominance and whatnot. So we'll refer the labs out that we need to. After those come back, then we'll do another consultation to go over them. Again, lifestyle changes, recommendations. So we're meeting on a either every 2 to 4 week basis at that point, just to kind of have that check-in. After we feel like you've reached your symptoms have been resolved or your goals have been figured out, then we kind of release you to kind of spread your wings and do your thing. But it's always nice to have those check-ins in case patients need that further care. And everyone's going to be different. You know, a chronic cancer patient looks a lot different than a healthy mom that's just looking for a couple labs to make sure she's doing great, you know?
And what kind of labs are you doing? You mentioned gut testing, you mentioned hormone. What else would you be looking for?
Yeah, we can honestly do almost any labs that your PCP would do. So, which is great because hopefully we can get them at a cheaper cost. I know a lot of people also were wondering if labs or this is covered by insurance. And unfortunately, the initial consult is not covered by insurance, but we can do HSA, FSA accounts. So we try to be really mindful of financial obligations. But then regarding labs, if people have insurance, sometimes we can write a letter to their PCP and just say, hey, this is what we're thinking for this patient. Are you able to run it? And then their PCP does, and we just get those results back. So we really try to be transparent and mindful of some of these costs. However, it's always tricky to know if the PCP or whoever is going to be on board of running those things. So we really try to get provider costing for the labs. But yeah, we can do a traditional CBC thyroid panel. We can do organic acid tests, mold testing. I mean, the list goes on for sure, which is cool for sure. But that was a whole world to learn as well as a chiropractor, because we're not taught how to do requisition forms and fill out all these different lab logistics of getting things ordered. And we're still learning. I mean, you know, every St. E's has a different policy than Theta Care, than just at-home kit as well. So it's true. Tricky.
Yeah, I bet.
You also mentioned supplements. And so are you able to be pretty transparent with it for somebody at that first appointment on like total cost? Because I think that is something that holds people back, is that they're just really scared that, okay, here's the initial fee that you can guarantee, right? Like here's how much tests are going to be and stuff. But then there's also the supplements after, and that until you actually see their profile, it's hard to know what you're going to have to recommend for them. So how do you walk people through kind of that hurdle of just being stuck like a deer in headlights and not making any steps forward because they don't want to be scared by the cost?
For sure. And we really try to be mindful of it, because you just hear of scary stories of like you walk in and you just spend, you know, $5,000. It's like, oh my goodness, that's crazy.
Yeah.
So we aren't also the clinic that's going to have our patients walking out with 14 different supplements. Like that's overwhelming no matter what. But what's really cool about the system that we use, it breaks it down in order of importance based on like what their goals are, but also what their health history is taking into consideration. So even though if they want to test maybe their hormone panel, our system that we use is actually really maybe pointing towards their gut or their liver or something. So we might shift our focus onto what our system and like our background is training us, and it might heal, you know, 90% of their symptoms just by shifting our focus on like the main target area. So our system really puts into priority of like, look at this, then look at hormones, then look at thyroid or something. So we really focus on like the top 3 issues. And half the time with supplements, you can really recommend certain supplements that target all 3 top goals instead of just piecemealing it here and there, so they're not walking out with a ton. So it's tricky for pricing, and I know that is a frustrating thing with the industry, but we do really want to test before we're just guessing and be like, oh, take this omega-6, take this turmeric, take, just guessing where that looks like.
In general, are there some supplements? And when we say supplements, I think a lot of times people go, what is that? But also just regular vitamins and minerals. Are there some things that really, living in Wisconsin, most people are typically low in? Like, should people be taking D3 and K2 on a regular basis, or omegas or magnesium, things like that? What are your recommendations for just everyday health?
Yeah, I would agree with that. I mean, without even testing for sure, everyone should be on a vitamin D with K2. Magnesium is a big one too. People think of that just for muscle relaxation, but it has so many different chemical reactions just in our body beyond that. Omega 3 is, I would echo everything that you said. It's just tricky because our soil just isn't what it used to be. So no matter if you eat organic and pasture raised and all the good things, grass fed, just from what our plants and our soil is being made out of now versus, 50 plus years ago, the quality just isn't there. So it's really important just to support your body, even if you are eating the healthiest you can be, for sure.
And then to switch gears a little bit, a lot of the listeners for our podcast are moms. Some of them are still in the childbearing years and some of them are well past that. But is there a space for the birth and postpartum world in functional medicine? Or is that kind of like if you're having symptoms that you want to have questions on, should you wait until after birth if you are currently pregnant? Or is there any piece that functional medicine can play in the actual prenatal and birth experience?
Yeah, absolutely. I mean, we can really walk along people with their fertility journey, whether they're struggling with that or they're just hoping to have more of a healthy journey along from conception to birth. We can really support those women in options of dietary benefits to doing the fresh test versus the traditional glucose, just giving them little nuggets on how to be best supportive. There are some limitations just with hormone testing and breastfeeding, of course, that we have to take into consideration. And hormones don't really level out until after 2 years postpartum.
Yeah.
So there's definitely some support that we can have there. But I still recommend the Dutch test even in postpartum because it's important to see how fluctuated they are. How do we help balance cortisol? How do we help you in those postpartum days that it can feel sometimes dark? So there are opportunities for sure, but there's just caveats that we have to take in consideration of supplementation, breastfeeding, and all those things. But there is definitely a space. It just kind of depends where they're at with it, for sure.
And you mentioned the Dutch test. I'm sure a lot of people have heard of that, but they have questions about it. So we actually have an entire episode dedicated to learning about the Dutch test and all the details behind it. So I think that'll be episode 3 in our series. But one more question for this episode. Now that functional medicine is becoming more common, where would you love healthcare to kind of look like in the next, 3-5 years?
I think just open-mindedness, to be honest. I wish that all of us could play in the sandbox better together, and I'm seeing it go there, but just amongst conventional practitioners with more natural, holistic-minded practitioners, I just don't want it to seem as strange for patients to reach out to a functional medicine doctor. I wish we could almost be the starting point, and that's really my goal, is that we become more proactive instead of reactive, and that's really our motto, and that's what our goals would be, is that I hope traditional healthcare goes that way. And I see it going there, but it's going to take a little bit for sure.
Mm-hmm. Yeah. And I mean, that's really our mission and our passion behind Motherhood Alliance too, is just helping people know that there's so many more natural options, people that are professionals who are willing to take 60 to 90 minutes to get to know you and really hear your story and hear what you're struggling with. And so we're excited. We're excited to see that happen. Before we close out this episode, I do want to mention that Dr. Mikhaila is offering $50 off of her initial consult if you're interested in connecting with her. The code is FVFM920, and we'll put that in the show notes as well if you're interested in taking advantage of that. But if somebody wants to contact you to either talk about that initial consultation or just ask you more questions, what is the best way to get a hold of you?
I would say via email, and it's a long email, but it's foxvalleyfunctionalmedicine@gmail.com. So long, but or just call our office and we can have that set aside time just to do a 10-15 minute over the phone. But a caveat to that as well is we can't really diagnose or treat over the phone in 10 to 15 minutes. So if they have got some quick questions, we for sure can answer, but it's just tricky. Sometimes patients will ask us some detailed, and it's way too hard without setting them up with a new patient exam and everything too.
And then for those who have maybe seen you as a chiropractor in the past, and now you're doing functional medicine, how are these two going to blend in your opportunities? Are they going to work together? Are they kind of separate and people have to kind of choose which piece that they need? Tell us about that.
No, they absolutely can. I see patients for chiropractic every 15 minutes, so we're not going to be able to dive into deep, thorough history in that moment. But if they show interest in wanting to do Fox Valley Functional Medicine, we can definitely set up an appointment, get that intake form and those logistics running too. We're starting to transition that we're going to have our chiropractic days in office, and then we're going to have our functional medicine days. And that's what our schooling really trained us to do, because it's such a different brain shift of treating people chiropractic wise and it's such a different detective hat for sure.
Yeah,
so we're going to start transitioning into having just FM days versus chiro days.
All right. Well, that's good to know that you're not like stopping being a chiropractor. You're going to be able to help people in both arenas.
Yeah.
So, awesome. Well, we have, like we mentioned, 3 more episodes together. Our next episode, we're going to be diving more into common symptoms that people are experiencing that might tell you that functional medicine could be a good route for you. And then in episode 3, we'll be diving more into the Dutch hormone test, talking all about hormones, estrogen dominance, perimenopause, things like that. And then in our 4th and final episode together, we're going to be diving into gut testing and gut health, which is, I know it's like a buzzword and everybody talks about it, but this is going to be really in-depth and probably answering some of the main questions that you have, and everybody could benefit from that episode. So stay tuned for our next one coming up. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.